So my specialty is abdominal wall reconstruction. It really focuses on complex hernia repairs. That's what my fellowship training is in. It's kind of a newer field. It's really grown over the last 10 years into something that's become needed because of multiple laparotomies and people getting complex traumas, and then all of a sudden they get an abdominal wall defect that is large and it's cumbersome, and so my interest is basically in reconstructing those individuals. One of the things I like to do is kind of get to know why they want their hernias fixed. How much is it impacting them? Does it actually impact their quality of life, or is it something that they can potentially live with? And that kind of guides me on whether or not taking on some of these larger operations are going to be beneficial to the patient. So there's a couple things that can impact a patient's outcome after abdominal wall reconstructions that they have control over, and like smoking, control of their diabetes, or optimizing their weight can ultimately impact how they do after surgery. And so we kind of take a team approach, try and get everybody to work on getting somebody optimized for an operation. So whether it's weight loss, I'll follow them up every 3 months until we get to that goal that's needed. If it's smoking cessation, offer them different opportunities and continue to follow them. And I try and keep engaged with them to make sure that they know I'm still going to be there for them and I'm ready to fix their hernia when they're ready. So one of the other things I see is chronic groin pain, which is a very complicated problem that people have after groin hernias. Almost 10% of patients get chronic groin pain after an inguinal operation. So that's one of my interests, and we're currently doing research in that area to try and improve outcomes after inguinal surgery, and also to devise procedures for patients with chronic groin pain and how we can help manage them. It's not just being able to do routine operations, but doing complex operations for people that it's really going to have a long-term effect on.